Good morning. Hi, I'm Caroline Kelly. I'm a senior design researcher for Workspace Futures at Steelcase, and I have the privilege of doing healthcare research for Nurture by Steelcase. So today we're here at our showroom at NeoCon, and I want to walk you through and talk to you a little bit about the connected caregiver. That's one of our main themes this year, really thinking about how to support the work that caregivers are doing, whether it be at the patient bedside, collaborating with each other, and especially we want to think about the use of technology in all those interactions. So let's come on and take a walk through. So we're here in the area of the showroom where we're highlighting our product Pocket, and actually I love the name of this because when I'm out in the field and I'm watching clinicians work, they're always hands full, pockets full, tons of stuff going from place to place. So the work is very nomadic, and we know that as mobility is a part of it and technology is a part of it, we wanted to really support that work and allow for a simple solution for our clinicians to be able to support their work wherever it's happening. So here you can see this is really, a minimal design, simple but not simplistic is what we were going for, and we've created a mounting surface for the iPad. We know that the iPad is being really widely adopted in healthcare environments and at like exponential rates, and there's so many apps out there to support how work is being done, whether it's a doctor being able to look at the tracings of somebody who's on a telemetry monitor wherever they are in the unit, to being able to bring patient education to the bedside. So we thought about that here, starting to highlight some of the great features that an iPad, for example, would support. Now we know that not every hospital is an iPad hospital, so this product is really able to support anything, be it a tablet, a traditional laptop, whatever the technology is now and is going to be in the future. We don't know, we can't predict that, but we can create something that can support it and be adaptable to it, for years to come. So we talked a little bit before about how clinicians are on the go and they want to work wherever they need to be. So here we can take this pocket cart and think about coming to a centralized nurse station and enabling an interaction where maybe this is just for a moment you want to come up, talk to somebody, have a quick consultation, and go on your way. The other thing that we always see is that there's been a lot of computers on wheels introduced over the last few years with very little consideration of where they're going to be docked, where they're going to be charged, how to support that. So we continue to torture nurses by asking them to bend down thousands of times a day to plug things in and take them out. And here, by creating just a simple docking station where they can plug right in here, get a charge, do their work. It's like a place for everything and everything in its place. That notion, by creating a nurse station that really thinks about holistically all the technology and all the equipment that's being used in one place, we can support those fluid interactions. On the other side, you can see that we have taken this workstation and created a peninsula that allows for people to really go shoulder to shoulder. So I'm sitting here in our infusion space, and God willing, I will never have to do this in real life, but we know many of our loved ones do. Cancer care, the numbers are increasing, and with baby boomers aging and people living longer, we can expect to see more and more cancer care needing to be provided. And when we thought about our cancer research, which was an extensive project, we really wanted to kind of take some of those hard edges off this really difficult experience for people. So creating a more intimate space where they can support family, offering comfortable seating for the family member. I love that we have the high back chair there, so if someone is getting an infusion, they might be there for 4, 6, 8 hours, and for the person who's accompanying them, that's like a long time to be sitting in a comfortable chair. So, headrest, you can sit back. We have television, opportunities for people to even bring their own technology and do work. this work surface here is really intended for the clinician to be able to come and sit and prepare medications and do work right here at the chair side. We know that transforming care at the bedside on the inpatient environment is a real initiative, so we wanted to think about transforming care at the chair side in these infusion areas and allow the nurse or other staffer to have a really easy, comfortable way to sit down and get at that same eye level with the patient as they're delivering care. We know that the relationship component in cancer care is really, really critical and really important to both support the patient, but also the staff members, nurses, doctors who are caring for these patients, and it's a tremendous emotional and physical toll on them. So we want to think about how to care for them and really help them do the best work they can do, but also nurture them through the environment. So we're here in a family telepresence space, and when we think about telepresence or telemedicine, a lot of the examples that we've seen out there are really highly clinical, where we want to enable like a traditional exam or a consultation with a doctor, with a patient, and almost trying to virtualize that exam room with all the equipment that's necessary to do an exam. Here we wanted to think about consultation in a little bit friendlier way, where it's about having a conversation. It's about creating a space where family and patients can come together with a facilitator. Maybe it's a doctor or a nurse or somebody else. We're seeing a lot of new roles in healthcare, health educator and different types of coaching or coordinator type position. So we have a space here where it might be more familiar to sit down in almost like a living room setting and talk to a doctor who's in another location, who's able to talk. In this case, the example is really about lifestyle change. So talking about diet and exercise and the things that are really some of the hardest parts of personal health to implement. Sometimes it's easy to go and get a test done and or go and have a certain procedure, but we know that those day-to-day decisions about lifestyle are really some of the things that have the greatest impact on our health and well-being. So we wanted to talk about a way to do that in this space, and I wanted to point out a little bit about this chair. You'll notice that it's on casters, and so if we think about someone who's facilitating, where they could roll this way, talk to the doctor, be able to be really fluid in the interaction, and then come back around perhaps and have some stronger eye contact with the patient or the family member. But we wanted to be friendly, wanted to be comfortable, and I have a colleague who talks about his 80-year-old mother who is actually getting some consultation through telepresence with the Mayo Clinic. She lives in the Upper Peninsula of Michigan, and he said that for her, some of the very high-tech looking telehealth environments are intimidating. She's 80 years old and she's 5 feet tall, so she's this sweet little old lady. And he said, this for her would be a really comfortable place to have those kind of interactions. So when we think about those kinds of stories, when we think about how to solve, for people who are, of all ages and experiences, and really try to bring the human side of care delivery to them. Because in the end, doctors and nurses are there to take care of people, and we want to support that. We're in our exam room, and one of the things that we've looked at over the years is how information is being shared in these exam settings. And really, traditionally, if there was a computer, it really was oriented towards the clinician, where maybe the patient and family are sitting to the side, the screen is really privy to the doctor, and there wasn't kind of an openness and transparency about information being shared. Before that, when it was a paper chart, who knows, it was in the doctor's lap, and I'm sure I know I've wondered, what are they writing down about me? So, as the electronic medical records are being widely deployed, we wanted to think about ways to bring that information to the conversation in a way that allows the patient and the family to really understand, more perhaps explicitly what the conversation is about, and as the content is being developed, like in this case we have an example here of a web page from Kaiser Permanente where they're thinking about ways to really make that information accessible to a patient, understandable, digestible, and not as highly clinical and technical as maybe it had been designed in the past for the clinical staff to be looking at it solely. So to do that, a small rounded table, really simple intervention here design-wise, but it allows the doctor and the patient and the family to sit shoulder to shoulder, have the screen, have a seat at the table, the information be visible for those kind of conversations. And you'll even notice that the mouse and the keyboard are wireless, so it starts to beg the question, well, whose input devices are those? Is it really just for the doctor, or is it potentially something that could be slid over and the patient could say, hey, let me show you this website, I was reading about my condition, can you tell me if this is good information, or let me show you my information on my Fitbit, I'll tell you about how much I've been running and we can look at it together. So this notion of potentially shared interaction with the computer is something that I think it needs to be considered moving forward. So we're here in what I think is a very beautiful patient room, certainly one with the light streaming in that anyone would, if you are unfortunate enough to end up in the hospital, would prefer to recuperate in this kind of space. I think it's also a space that clinical staff would really like to work in. Here we see the pocket computer where this isn't meant to be rolling around the hospital. This is something that, a lot of hospitals will have a dedicated computer in the patient room, and yet the idea of it still being on a cart is really important because it allows for these kind of micro adjustments in movement, where if the nurse is entering information, doing an assessment, the computer can come and she can, or he can look at the patient, enter information, and have a much more humanistic kind of interaction. Let's say there's something that then we need to confirm with the patient, like, can you tell me, are these your medications? Is that correct? It's easy to bring it to the patient. As CPUs are still being used and things need to be plugged in, we can accommodate that by bringing some power to the head wall for this computing use. And yet, if they want to take this computer and move it to the foot wall and do some work over there, that's possible too. This foot wall, when we think about things like med prep and important things like hand washing, we've created a zone for that right when you come into the patient room. Waste here, hand washing sink there, and you'll notice that this is free and clear on the floor for easy cleaning when environmental services come in. Lots of small ways to improve the environment, to make the job easier for clinical staff to do what they're doing, and also to make it a more restful and recuperative environment for the patient. We're standing outside our immersive space and can look in and see that we have another telepresence environment. In this case, we know that, especially on the acute care floor, so much is going on at the bedside, at the nurse station, but sometimes clinicians need to go off stage and need to have more in-depth conversations, sometimes conversations that aren't really ideally situated out in a public space. We also sometimes know that they want to bring in conversations, people from the outside, and in the past, the nomadic healthcare worker, doctors would be rounding in the morning, doing clinics in the afternoon. Well, what happens when you want to have that important conversation to get a consultation, let's say, if a patient's turned for the worse during the afternoon? Do it on the phone, but here now we can do it with telepresence, where everyone can be around the table looking at the same information on one screen and then having an eye-to-eye conversation with somebody else, a clinician. Maybe they're on the same campus, maybe they're half a world away, to be able to talk about a patient and really deliver the great care that's possible when clinicians can collaborate. So we do that here at standing height. Right now you see there are several people seated around the table, but imagine if it's a larger group, which it often is in healthcare. That standing height allows people to gather around, stand, and be able to interact as well, and kind of support that expanding and contracting group, which we see often in the inpatient environment. Thanks for coming to the showroom. We really hope that you leave with this main idea, that while staff needs great technology, great furniture, great solutions to help deliver care and to be connected with other caregivers, in the end, it's really about caring for people, caring about the patient, caring about the staff, caring about the families in a nurturing environment that helps make it just a little bit better.